Good evening. My name is Julie Waight. I am a headache specialist from Danbury, Connecticut, and I am here tonight to talk about living with daily headache. 90% of my patients do suffer from daily headaches, and they tell me it's a very difficult condition to live with. One of my patients tells me that on a good day, her headache is like background noise, and on a bad day, it's like having a jackhammer in her head, and she says that she feels like she'd like to just crawl under the covers and forget about the day, but unfortunately, she has to take her children to school, and she can't do that. So what we're going to talk about is a few tips that can help to make this very difficult condition a little easier to live with. When I first meet patients in consultation, we work together to formulate a plan that can help them. And I explain to them that just like diabetes and asthma are medical conditions, that daily headache is a medical condition that is going to require both medical, like medicine, to control the headaches, but also is going to require what we call non-medical management as well, or healthy living. There's so much that can be said about this topic, and unfortunately we only have a little bit of time. So we're going to just basically scratch the surfaces of what we're going to talk about tonight. When it comes to medication, I explain to patients that due to the fact that they have a headache every day, medication is going to make their headache condition better. We can't ever make them headache free, but we can control their headaches. The goal of our medication is to decrease the frequency and how bad their headaches are by about 50%. And the medicines that we have are good medicines. But just as sometimes the headaches have taken years to develop, they haven't come on suddenly for most people. It's going to take some time to get them to be better than they are. And so medicines are going to take time. We also explain that every medicine has a side effect. Whether you're taking a tablet of Tylenol or whether you're taking a tablet of nortriptyline, there are going to be side effects. And once you get past the side effects, you're going to experience the benefit. So it's what I always tell them, that headache management is a work in process, but there's always good things at the end. So I ask them to be patient. I ask them to hang on, and I always have an open communication with my patients, and I always tell any headache sufferer, whether they're being seen by a headache specialist or not, that it's important to have a good relationship with your provider so that you can always feel free to ask him or her about your medications, and to always feel free to call and say that you're having problems. Because one of the biggest mistakes made by both patients and providers is that they stopped taking medications too soon. So we have a multitude of medications, and this year is probably one of the best times to be a headache sufferer because we have lots of new medications, we have medical devices, all that can benefit patients who have both episodic headaches and daily headaches. And so you always want to have the conversation with your provider to see whether you would be a candidate for any of the newer therapies. I always ask my patients as well to keep a headache calendar. And many times this is met with resistance because, I've had patients ask me, well, if I have a headache every day, what's the point? The point is that when you keep a calendar, it's good for you because you're taking an active part in your care and you're writing down when you get headaches, how bad they are. And you're also providing a record that when you look back, you can see how effective the medications that you're taking are in terms of whether they're working or not. And it's a wonderful reference for us as providers because we also can see whether the medicines that we're working with are effective, whether they need to be increased, whether they need to be decreased, or whether they're just not working and we need to just start with something else. So now we have, you don't necessarily have to use paper anymore. We have these wonderful free applications that are downloaded on the cell phone. And most of my patients, I've never seen any patient without their phone. You carry all your information with you right to your visit. So it makes it very easy, very simple, and very informative for both you and for us. The second thing I want to discuss that is very important and is a big problem for patients who suffer from illness, but also for a lot of people, is the issue of sleep. We see that so many people today are walking around sleep deprived. Sleep is a huge trigger for headache patients. Lack of sleep. And usually in my office, we discuss sleep and we take it very seriously. So if I can rule out any medical reasons why patients don't sleep, then we talk about sleep hygiene. I'm surprised at the fact that many people don't have a set time to go to bed and they don't have a set time to wake up. And so that's what we start with first, is getting a set bedtime, getting a set time to wake up, making sure that the bedroom is a comfortable place, that it's dark enough, warm enough, cool enough. We leave the television off, we leave the pets outside, we make it a very therapeutic place for sleep. We also talk about avoiding caffeine, alcohol. I ask my patients specifically about sleep aids, whether they're over the counter or whether they're prescription, because many times it's very difficult to establish normal sleep rhythms when patients are taking things like Ambien or Xanax or over-the-counter Benadryl. It makes it difficult for them to sleep. And many times I have found that patients who take prescription, especially benzodiazepines, things like Ambien, that can also precipitate headache. So we look at those things. Some of the sporting devices, things like Fitbit, are wonderful because patients wear them to bed and they can actually monitor their sleep. So they can see not only how long they're sleeping, but actually the amount of time that they sleep in deep sleep. So it's good for them. They can keep a record of these things. Watching caffeine intake, avoiding exercise before bed are all things that can also be helpful. Looking at listening to relaxation tapes can all be ways for patients to benefit in terms of sleeping. And then lastly, the last point I'd like to make is talking about stress and stress management. And sometimes, my patients will tell me that, stress is kind of overrated, that a lot of times they'll, regardless of what provider they go to, the topic of stress always comes up. And I had one patient actually tell me that, she feels that when her providers tell her that it's a result of stress, it's almost like saying to a headache patient, well, it's all in your head. But today, very stressful lives. We're always running here and there and doing and coming and going. And whether you have headache, whether you have diabetes, whether you have asthma, this constant barrage of stress does not do good for any medical condition. And so it's not any surprise that stress is the #1 trigger for migraine sufferers. And for patients who have a headache every day, it can be even more so. So when you're thinking about getting up, going to work, getting your kids ready, coming home, making dinner, it's a very difficult stressful situation, and it is certainly a good reason why people get headaches. So in addition to sleeping, we work on stress management. And one question that I've always asked, and I've always been trained to ask, is, what do you do for relaxation? What do you do for fun? And patients look at you like, that's a very odd question that you're asking. And many people don't have the time to even have recreation, or they don't carve out time for themselves. And that can be a problem. So regardless of whether you have episodic headache or whether you have daily headache, taking some time for yourself is very important. So what I tell my patients is that you need to carve out at least 20 to 30 minutes a day just to have me time, whether you want to read a book, go for a walk, sit, do nothing, talk on the phone, whatever it is that you enjoy that gives you a moment to kind of recharge your batteries without dealing with family, children, husbands, wives, bosses, whatever. It really makes a big difference in terms of headaches. And so I have patients who actually have to schedule it like an appointment, just as you would take time to eat your dinner or time to go to a doctor, you need to schedule your 30 minutes in your day to do whatever you need to do. And a lot of times things like exercise, going for a walk, doing a yoga class, these are all wonderful ways to release what the body naturally produces, which is endorphins, which are, natural painkillers. So, sometimes I've had patients tell me that when they first start to have a headache, if they go for a walk or they do some light stretching, they actually do not get the headache, or the headache goes away because the body releases these natural endorphins. When you exercise, your body releases serotonin, so people start to feel better. When you do something for yourself, when you take the time to get away and maybe just have time to think, go out and meet a friend, or if you do some exercise, you run into friends or you get out of the house, it makes a big difference in terms of headache. We have research that shows that mindfulness, meditativeness actually makes a difference in terms of the way the brain functions with relation to headache. We know it works in pain. So there is a medical reason, or the research supports the fact that the more you take time to be mindful and the more stress management you do, the better off your head is. So these are just a few little tips on how we can take a chronic condition such as chronic headache that is a very difficult condition to live with, and that usually comes with a very poor quality of life, and yet we can make it better. We have medications that help to decrease the frequency and intensity of headaches. And when we take the medications and we do our due diligence in that regard, we do better. When we look at our lifestyle, when we take the time to really work on sleep, when we look at our stress levels and we try to the best of our ability, no one's going to be stress-free, but if we can find little areas in our life that we can kind of cut a little bit of stress off of here, as those in the 12-step program say, one day at a time. We all know that we could worry forever, but each day is going to have its own anxiety. So if we can just get through, eat one day at a time, if we can learn to manage our time so that we're not worrying, or we're not putting too many chores in a day that we won't have time to do, if we can take for ourselves, patients who really work at these things even though they have chronic migraine or chronic headache or even episodic headache, really find that it makes a difference. And so with that, I think I'm going to open the floor up for questions, and I thank you so much for your attention, and I thank you for joining me tonight. Does anybody have questions or? Is there anything that anyone would like to bring up or that I didn't mention, or if they have any questions about something else? Okay, I'm looking at one comment that says that medicines are like trial and error, and yes, they are. And what I will say about that is the one unique thing about headaches and migraine is that everybody's head is different. So what works for one person isn't going to work for somebody else. And so every person that you see, it's sort of like reinventing the wheel every time. And when you read the studies or when you hear the commercials or when you talk among friends and suggestions come up, and you know, when you have headache, it seems like everyone knows the right thing to do. You have to take that information with a grain of salt, because again, that information might work for the group of people that the research was done on, or a certain group of people might find that, you know, something triggers their headaches or causes their headaches, and for 2 or 3 people something works for them. Doesn't necessarily mean it's going to work for you. So that's why I personally think that headache is such a fascinating field, because I don't think any other field of medicine is like this. You know, everybody's individual, that's true, but it's really, you see it really intensely in headache and in migraine. And so, whereas medications are trial and error, I think the thing is that it's important to never give up on someone and to just try to work with them to find the right thing. And I can tell you, in my experience, I have some very, very difficult patients, and it's taken a lot of time, but we have found things that work. And so sometimes they're unconventional or sometimes they're off label, but things do work. And I see someone here talked about Aimovig, lost hair on the 4th dose. Wow, that's very unusual. I've never heard of that. But one thing I will say about the CGRP antagonist medicines, Aimovig, and Amjovi and Emgality, they are very excellent medicines so far, and they have, you know, the preliminary data has been really wonderful for both the episodic and for the chronic migraine groups. And they have made a difference, especially for a lot of patients who have suffered chronic migraine. And usually, although Debbie, in your case, that's a very unusual side effect. I've never had a patient that has said that, but usually they are well tolerated with close to no side effects at all. But there is a lot of new therapies in the pipeline. There is a medical device called GABA Core, which is wonderful for patients sometimes who have problems, controlling medication use. And that's FDA approved for use of both in migraine and cluster. And I have patients who really, really like it. It's easy to use. It's portable. It's always something you can ask your providers about or look it up on the computer. It's called GABA Core. It's a vagal nerve stimulator. So if anybody else has any comments? I guess if not, then I will say thank you very much. It was a pleasure to be here tonight, and I wish you all good night and good luck with everything you're doing, and a happy and healthy and headache-free New Year. Thank you.